Last but not least, and I'm taking a little bit of a twist on Women's History Month and women's health in the city of Newark that we serve. I'm Annette Hastings. I'm the Chief Administrative Officer for University Hospital. I lead the ambulatory practices at the hospital, and I am also a graduate of UMDNJ. I did my dietetic internship here in a year that I won't repeat to anybody. Women's health is in the forefront of what we do here at University Hospital, and we have been very successful in developing a couple of programs, and we are on our way on a number of other areas in women's health. And as you can see, the pictures I put up here span the life of a woman, particularly who live in the city of Newark, from being young adults to pregnant women to mothers to joining the ranks of us, which is the gray-haired generation. Oop. Let's try it again. Is it the wait button? There we go. So the trends in Newark, and they're not, I wouldn't say they are the most happy trends, but the women in Newark are much less likely to seek prenatal care. They don't obtain routine mammograms. They're less likely to seek postpartum care. They are more likely to have low birth weight infants. They are much more likely to be diagnosed late in stage with cancer, and there's a much higher incidence of HIV and AIDS amongst women who are resident in the city of Newark. I wouldn't think this was a surprise to any of you. This is a population that doesn't seek active care, and we're in the process of working in the community to change that. And the telltale sign of women's health is infant mortality, and as you can see, especially in the Black population, infant mortality runs higher than it does in the state and in the country as well. So what are we doing? That's the question. We see three areas of focus for women in the city of Newark. We have a very focused attempt at working with women of childbearing age. Cancer care and cancer screening is another focus of ours, and then women in chronic disease. And as you can see, these are some of the things that we're working on. In the area of women in childbearing age, we are working with the Greater Newark Healthcare Coalition on Healthy Women, Healthy Families, which is a grant-funded program where we are putting community health workers not only into the community but into our practices to help with prenatal and women of childbearing ages to seek healthy lifestyles and make healthy choices before they become pregnant. I would say that our OBGYN faculty under the leadership of Mark Einstein is one of the best I've ever worked with. They have leading practices in a number of areas of prenatal care, including centering, which helps to develop a community of pregnant women, keeping them from being isolated while they're in their pregnancy, which has developed and proven positive outcomes for pregnant women and newborns. We also do a program called PINES, which is a cooperative endeavor with the March of Dimes to help with ensuring that the right care at the right time for high-risk pregnancy is occurring, so that we're limiting the possibility of negative outcomes for childbirth. We're also using a system of navigation for pregnant women so that they get the care they need dependent on their course of pregnancy. So, and the community intervention is another key part of this. The federally qualified health centers in the city don't all provide a prenatal care, so that we are the referral site for them, and the pregnant women come to us to seek prenatal care and hopefully deliver with us. Cancer care and cancer screening is a foray that we're just getting into. Women's cancer, especially gynecological cancer and breast cancer, is often found in the late stages in women in the city, so that we are working with the Cancer Center team to be out in the community, screening, working with, again, with Dr. Einstein and the gynonc faculty to ensure that if we get patients who are identified with gynecological cancer, they are treated early, treated well, and have successful outcomes. And then lastly, women in chronic disease. And this is probably the newest area that we're working in. And this is around the population health work that we started about 3 months ago. Community health care chaplains, they're not community health care workers, are out in the community working with our patients who are seen to be frequent high utilizers of the emergency room, both men and women, but with a focus on women, to help them develop skills to manage their own disease process and work with them to become their own advocates in health. So some of the outcomes, most of which you'll see are in prenatal care. We are a regional perinatal center. I know it's hard to read, I'm sorry, I'm trying to get it all in. Which means that the most seriously acute and complex pregnancies are managed here at University Hospital in collaboration with our faculty at New Jersey Medical School. So these are our outcomes. We have one of the lowest C-section rates of all hospitals in New Jersey and the second lowest cesarean rate for a regional perinatal center. We have 0% elective C-sections, which is pretty amazing because if you go to some of the tonier neighborhoods with different patient populations, you'll see a much higher C-section rate than 0. We have the highest successful VBAC rate, vaginal birth after C-section, and that's for all hospitals in the state of New Jersey. We have one of the lowest rates for primary episiotomy, and Dr. Einstein will argue with me that that's not always great because sometimes you need to do it to make sure that the mother is in better shape after delivery. And then the last thing is that we were the first hospital in Essex County to be designated baby-friendly, which means that we have a high rate of breastfeeding, and it's a designation for breastfeeding in a hospital. So we push breast first. Our interventions, and these are the progress that we've made, our community outreach efforts have quadrupled. We are making a difference. The Familiar Faces pilot, which is what we call our community health care chaplains model, is showing strong success in the rising risk population, which is the patient group that has the potential to become uncontrollable in their chronic diseases. So we're trying to hit them before they get to that point. Our partnerships with the Greater Newark Healthcare Coalition and the Healthy Newark Accountable Care Organization is working with residents in their homes, in their communities, going out to see women to make sure that they are maintaining a healthy lifestyle and supporting them through any challenges they have around social determinants of health. And then lastly, our screening initiatives are booming. We have a mammography van that we take all over the city to high schools, to the FQHCs, where we screen for women at risk for cancer as well as other issues of health, so that we are out in the field seeing people and making sure that we're making an impact in collaboration with our physicians. Thank you.